opinion matters, so let your voice be heard. Let's talk about nursing. Right here. Rapid Response with John. Good morning, Philippines! Good morning! Kumusta po kayo? Anyway, it's Mother's Day special. Diba? May Mother's Day special ako nalalaman. Anyway, napabilis lang daw, bigla ang stream lang to. When I woke up like an hour and a half ago, I received a mail. Not a mail, I received a message from isang Facebook user, and then he's requesting if I can discuss this specific topic. Okay, so this is for you, JV. So this is your requested topic. Ang daming din request niya, no? Respy, ano nga yun? Pakita ko sa inyo. Here. Ano requested niya? Sabi, hi Sir John, hope na ma-discuss po niyo ang respiratory disturbances, care of patient with chest tube, draining system, and mechanical ventilator. Sorry po, daming request. So hindi siya pwede ma-discuss in one session. So I decided na i-dissect natin yung concept, and then magsisimula muna ako sa chest tube. Okay, and part intro ng respy chest tube. And then this coming May 19, we'll talk about mech vent and other respiratory disturbances. Okay? So yun nga. So anyway, bagong lahat, good morning po. Kumusta po kayo? Today is actually May 14 and it's actually 2:11 p.m. my time. So sa Pilipinas, madaling araw ngayon. It's 3 a.m. in the Philippines. O, diba? So, ay Monday ngayon sa Pilipinas, and then tawag nito, good luck pala sa good luck pala sa aunt ko who will have a procedure to be done today. And happy birthday pala sa aunt ko ngayon na nasaan ba siya? Nasa Las Vegas. Hi! Sorry, wala ako dyan to celebrate. But anyway, age is just a number. So, enjoy, have fun. O, diba? And of course, sabi ko nga Mother's Day ngayon, nabanggit ko nito sa stream ko early this morning. I said, give this day to them. Don't let them work. Paglutuan sila, okay, just for one day. Tapos bukas, ma'am ha, hindi na Mother's Day ngayon, balik ka na sa trabaho mo bukas. Ibig sabihin sa 365 days, one day lang yung pahinga nila, sa Mother's Day lang. Anyway, thank you so much sa lahat ng mga, hindi lang sa lahat, lahat in general, no, lahat sa mga magulang natin. Thank you so much for all the concern, for all the love, unconditional love that you gave us. And of course, buhay po yung mga magulang natin, buhay yung mga, especially if your mom is still alive, spend time with them, no? And a big shout out to my mom. May she rest in peace. May she rest in peace. My mom passed away last 2000, August 9 of 2000. My God, it's 20 plus years ago. Parang kailan lang, ano? My mom passed away because of, what do you call this? AML. It's acute myelogenous leukemia, and she eventually developed a complication of ARDS. It's acute or adult respiratory distress syndrome, secondary to, ano nga yun? Secondary to hyperleukocytosis. Ibig sabihin masyadong tumaas yung WBC count niya, and that causes organ damage. Anyway, who do we have here? May comment dito. Ano to? Thank you sa request, Sir John. JV Mata. Oh, hey JV, this is for you. Okay, so request mo to, and request granted. O, diba? Bagong gising lang. Nasa mood ako mag-lecture. And I have work tonight, so might as well do something na, tawag nito, makabuluhan than just watch TV and kain na ng kain. So I decided to do this stream, and this is your requested topic. So sabi ko nga, mahaba yung, at malaki yung concept na gusto mo ipa-cover sa akin. So I decided to dissect it instead of isang bagsakan na lecture. Ida-dissect muna natin, mag-respy muna tayo na intro, and then we'll talk about, what do you call this? Chest tube. Okay, chest tube. Bakit ako nakatingin dito sa monitor ko? Dapat nakatingin ako sa camera para nag-uusap tayo ng may eye-to-eye contact daw, sabi. Kasi minsan, hindi ako nanonood, hindi ako nakatingin sa camera. Tinitingnan ko yung monitor. Okay, anyway, so yun nga, so sit back. I hope you learn something, whoever and wherever you are. This is in preparation for your examination. This is not only for NCLEX exam. This is also a lecture that may help you if you're planning to take any qualifying examination. Okay? And this concept is actually under fundamentals of nursing, pero i-incorporate na lang natin sa medical surgical. Okay? So what I'm going to do now is I'm going to share my screen and we will start with the basic respite and we will talk about different chest tubes. Okay? Ito yung lecture ko kayo na umaga. Okay. Okay. So we have here our lung. Ito naman, ayaw naman gumana ng. There. So we'll talk about your respite. Okay. This is your respiratory system. Okay, just a rundown, quick rundown. Hindi ko na siya isusulat, sasabihin ko na lang para mas mabilis, para may enough space ako mamaya. Okay, your respiratory system is a system that plays a vital role for ano ba to? Baka mahulog. It plays a vital role for, of course, your gas exchange. Okay? So when you talk about gas exchange, I am referring to what we call external respiration. So you breathe in and you breathe out. Okay? Air gets inside your lungs, and by virtue of diffusion, diffusion, there's movement of molecules from a higher to a lower concentration. There'll be gas exchange, between the atmospheric area and your blood, especially in your alveoli. Well, remember, the entire alveoli will not play with your gas exchange, not the entire alveoli. Part of the alveoli is responsible for gas exchange, and that is what they call the alveolar capillary membrane, or the ACM. So kasi sabi nila, alveoli is a site of gas exchange, yes, but not technically the entire alveoli. Part of the alveoli that touches the blood vessel, the capillary, so that's your alveolar capillary membrane. So you breathe in and then you breathe out. Okay, so yung respiratory system natin, importante yun, of course, to have an adequate oxygen level in the body, and the normal O2 saturation ranges from 95 to 99%. Okay, remember your O2 saturation is expressed in percentage, and it's different from your partial oxygen pressure. Okay, the primary stimuli for you to breathe is actually an increase in your carbon dioxide. So if you have too much carbon dioxide in the body, it stimulates you to breathe. But for patient who is a COPD, it's a different thing. So pag COPD ka, chronic obstructive pulmonary disease, it's an old name. The new name for that is CAL. That's your chronic airway limitation or chronic airflow limitation. Iba yung stimuli nila to breathe. Okay, compared sa normal na tao. Pag COPD ka, your stimuli to breathe is actually hypoxia. So we call it as your hypoxic drive. Okay, so ibig sabihin, pag COPD, pag mababa ang oxygen niya, it drives the patient with COPD to breathe low oxygen. Having said that, pag COPD ka, we discourage giving them a high flow oxygen, because remember, if you give them too much oxygen, okay, they will eventually lose their drive to breathe. Kasi sabi nga natin, their primary stimuli is hypoxia. That's your hypoxic drive. So just a thing to remember. Okay, so in your brain, the primary structure that regulates respiration is your medulla, or the medulla oblongata. Okay, your medulla or medulla oblongata is the center for respiration, the center for blood pressure regulation as well. That is why any damage, any injury, depression in your medulla can cause cardiopulmonary arrest. So pwede rin pala ma-depress yung medulla, yes, especially if you give the patient too much depressants, mga downers. Okay, so ano yung mga downers or depressants, drugs or agents that can cause depression of your medulla or medulla oblongata? Sa review, ang tawag ko dito ay ABNO. ABNO. So ABNO, ABNO, these are medications, these are agents that can cause depression. Yung mga tinatawag nating downers. Ano ba yung ABNO? A stands for alcohol, B stands for barbiturates, N stands for your narcotics, and O stands for your opiates. Okay? So these agents can cause depression. Sir, alcohol depressant pala? Yes. So di ba, sinasabi nila pag torpe ka, uminom ka doon ng alcohol kasi it's a stimulant. Sabi na, pampalakas ng loob. Well, actually, there's true behind that. Okay, if you drink alcohol in little amount, it becomes a stimulant. But if you drink alcohol in excessive volume, excessive amount, it becomes a depressant. Okay, so yung sinabi kong alcohol, if consumed in excessive amount. Okay, so again, your alcohol, barbiturate, narcotics, and opiates. These are what we call depressants. So if your patient takes any of these agents, any of these medications, you need to carefully be mindful with the respiration of your patient. Kasi nga, pag bumaba yung respiratory rate ng pasyente, that's an indication that kinadidepress yung medulla oblongata because of those agents. Okay? Now, sir, akala ko ba pons yung respiratory center? No. The medulla oblongata is the respiratory center. Your pons will help regulate respiration. Okay, nakakatulong din siya. But the primary regulatory center there is actually your medulla or your medulla oblongata na makikita saan? Na makikita sa brainstem. Okay? Anyway, so let's proceed. So there's such thing as inhalation and exhalation. So one common concern when you talk about respiration is the chest trauma. Na dito natin ipapasok yung, na dito natin ipapasok yung sabi ko nga na chest drainage or chest tube, yung water seal drainage. Okay? So when I say chest trauma, there are two common chest traumas you need to remember, the non-penetrating and the penetrating chest trauma. Ano yung pinagkaiba? Tingnan natin. Okay, here. Add to stream. Dito ka. Okay, so when you say chest trauma, now there are two types of your chest trauma. First is what we call the non-penetrating chest trauma, and the other one is your penetrating chest trauma. What's the difference? Of course, pag sinabi mong non-penetrating, there's chest trauma, but the chest wall of the patient remains intact. Okay? So, ibig sabihin, may chest trauma ka, pero walang butas, walang penetration sa chest wall. Okay? Usually, the non-penetrating chest trauma, the number one, okay, the non-penetrating is associated with an accident and you failed to wear your seatbelt. Can you imagine that? For example, you're hitting the road at, let's say, 160 miles per hour, and that's very fast, okay? And you failed to wear your seatbelt. So what happened when you crash into something and you failed to wear your seatbelt, the steering wheel, what will happen? Magkakaroon ng impact yung chest wall mo sa steering wheel. Ibig sabihin, there will be chest trauma, okay, because of the steering wheel. It can cause trauma in your chest, pero the chest wall remains intact, walang butas, walang penetration. But deep inside, okay, there is an injury. So we call the type of chest trauma as non-penetrating chest trauma. Kaya importante po, you wear your seatbelt when you drive. Wearing seatbelt saves life. Okay? Kaya nga, it's a law that you need to wear seatbelt. May mga ibang driver, ayaw nila mag-wear ng seatbelt kasi feeling na nasasakal sila. I know, but remember, nasa huli ang pagsisisi. Ang dami ko naging pasyente because of this. Okay? Failure to wear seatbelt, and it resulted to a massive injury. So again, it's a non-penetrating chest trauma, okay, usually associated to patient, okay, with failure to wear seatbelt. Pero marami pa rin pong reasons kung pwede ka magkaroon ng non-penetrating chest trauma, hindi lang because of failure to wear seatbelt. But again, isa sa mga indikasyon yon, isa sa mga rason, because you failed to wear seatbelt. And guess what? This non-penetrating chest trauma usually can cause an injury, okay, a problem called flail chest. Okay? It can result to a condition called flail chest, and I will discuss that in a bit. Okay? Pag sinabi ko namang penetrating chest trauma, in short, this is a type of chest trauma na may penetration. There is a break in the chest wall's integrity. Most probably binaril ka or sinaksak ka. So there is what we call penetration. Okay? So sinaksak ka sa chest or binaril ka sa chest, that's your penetrating chest trauma. And guess what? Because of penetration, there will be bleeding. Okay? Because of penetration, there will be entry of air into the pleural area. So ang dami palang complication associated with your penetrating trauma injury. So because of penetrating chest trauma, okay, ano mga possible conditions associated under this? So because sabi ko nga, there is what we call butas, may penetration, air can get inside. And what do you call that condition when air accumulates in the pleural space? We call that problem as your pneumothorax. Pneumothorax. And because of penetration, there is bleeding, and if there is bleeding, blood accumulates in the pleural space. We call that condition your hemothorax. And sometimes there's a combination, no? Tara no combination, combo. Okay? So may blood na, may air pa. You call that condition as your hemopneumothorax. Okay? So what I'm going to do now is I will discuss them one by one, and then we will incorporate here chest tube. Okay? So let's begin with your flail chest. Nabanggit natin yung flail chest that it is usually a problem associated sa non-penetrating chest trauma. And kailan ba lumalabas yung flail chest? Lumalabas yung flail chest to patient with multiple rib fracture. Sabi nga kanina, if you failed to wear a seatbelt and you're hitting the road at 160 miles per hour and then you crash in the steering wheel, what happened? Crashes on your chest, and that resulted to multiple rib fracture. So one common condition associated there is your flail chest. So yung flail chest, common na lumalabas to patient with multiple rib fracture or to patient with 3 or more fractured ribs adjacent to each other. Okay? So again, because of the multiple rib fracture, ang pasyente po may flail chest, ang common hallmark niya, okay? Ang common hallmark ng patient na may flail chest is, okay, paradoxical respiration. Paradoxical respiration. So ano ba yung paradoxical respiration? So what I want you to remember in your examination about paradoxical, which is a hallmark of your flail chest, is the movement of the chest wall. Remember when you inhale, okay, normally when you inhale, when you breathe in, the chest wall rises, okay? Why is it important for the chest wall to rise, to expand? That is to promote lung expansion. Okay, and when you inhale, the alveoli inflates. Am I right? So it's justifiable because when you inhale, air gets inside. So technically, the alveoli will inflate. And what else? So the chest wall rises, the alveoli inflates, the diaphragm goes up when you inhale. Okay, so why is it the diaphragm goes up when you inhale? Okay, sorry. The diaphragm goes down when you inhale. I just want to correct myself. So when you inhale, the diaphragm goes down to promote lung expansion. It is during exhalation that the diaphragm goes up to push air out. Okay? So ulitin natin ha. Normally, okay, ito yung normal movement. Inhalation and exhalation. Okay. So you have here your chest wall. You have here the alveoli, and then your diaphragm. By the way, the diaphragm is the major muscle for respiration. Okay, tell me. When you inhale, the chest wall rises. Okay? It rises. It goes up. When you exhale, the chest wall falls. It goes down. Okay? When you inhale, sabi ko nga dito dapat nakatingin eh, kaya hindi sa monitor. When you inhale, the alveoli inflates. When you exhale, the alveoli deflates. Okay? When you inhale, the diaphragm goes down. When you exhale, diaphragm goes up. Okay? So don't forget this. When you inhale, the chest will rises, the alveoli inflates, the diaphragm goes down. That is to promote lung expansion. Okay? When you exhale, when you breathe out, okay, the chest will falls, the alveoli deflates, and the diaphragm goes up to push the air out. So these are the normal movements during inhalation and exhalation. Okay? Now, what happens in your paradoxical is that it's the opposite, especially we're referring to the chest wall movement. Okay? So in your paradoxical, we're referring to your chest wall movement. Okay? opposite. So when you say paradoxical respiration, it is defined as an opposite movement. Okay. So normally when you inhale, the chest wall rises, but in your paradoxical, when you inhale, it falls. When you exhale, normally it falls, but in your paradoxical, when you exhale, it rises. So it's the total opposite. So can you imagine that when you inhale, the chest will falls. So there is always a risk that you puncture your own lung tissue because as the alveoli inflates, the chest wall gets inside. So there's always a risk that you puncture your own lung tissue. Okay? So because nasabi ko, opposite yung movement niya. So tandaan lang, paradoxical respiration is the opposite movement of the normal movement of the chest wall during inhalation and exhalation. So kailan lumalabas? Kailan lumalabas yung paradoxical respiration? A patient with multiple rib fracture, or to be specific in NCLEX, 3 or more fractured ribs adjacent to each other. So ulitin natin paradoxical respiration is common to patient with multiple rib fracture or to patient with 3 or more fractured ribs adjacent to each other. One common question in your NCLEX here is how would you position the patient with paradoxical? The question is how will you position the patient? The answer here is side-lying position, lying on the affected side. So ibig sabihin, if the fractured area is on the right side, position the patient on the right side to immobilize the fractured area. Immobilization, okay, will decrease the risk of paradoxical respiration kasi nga may fractured ribs. So you need to immobilize the area. Okay, if you haven't seen a paradoxical respiration, I think I have a video for that. Hanapin ko lang. Saglit lang where is that? Video. Where are you? Lecture. Video paradoxical. Paradoxical. Na siya sa aking folder. Oh, here. I don't own this video, so whoever owns this, I saw this one on YouTube. So whoever owns this, credit to you guys. Okay, here. So this is a patient with a paradoxical respiration. Okay, this is actually his left side. I don't know if you can see the cursor moving. Okay, this is the left side. This is the left chest. This is the right chest. Okay, yung paradoxical niya is andito po sa left chest. Remember, I said normally when you inhale, the rib cage rises. Okay, and when you exhale, the rib cage falls. But what happens here on this side, sa affected area, yung paradoxical sa affected part lang Okay, so when the patient inhales, you will see that this part here moves inward, but this side here on the chest wall rises when the patient inhales. But as the patient exhales, the rib cage falls on this side because it's normal. But on this area with paradoxical, what happens? It moves outward. It rises. So take note, this is your paradoxical. I'm going to play the video now, and I want you to watch it closely. See this? It moves inward. It moves inward. This side moves, okay, it rises. So you call this problem as your paradoxical. There is opposite movement in the normal movement. Okay? So I hope nakita nyo yan. Okay, so you call that problem as your paradoxical respiration. So the problem with your paradoxical is that eventually it can cause lung collapse if not treated. So what important management here is insert chest tube to drain and release the pressure out. That will promote lung expansion. Okay, so again, paradoxical respiration is a hallmark of a patient with flail chest. Flail chest happens to patient, okay, who usually happen to fail to wear seatbelt, or to patient who sustain multiple rib fracture, or specifically 3 or more fractured ribs adjacent to each other. Okay, so again, that's one complication associated with your non-penetrating chest trauma. So another type, okay, another type of chest trauma is your penetrating chest trauma. Nasaan na yun? Ang gulo ng aking presentation, feeling ko lang. Ang gulo ng aking slides. Okay, so we're done with your non-penetrating chest trauma. We're done with your flail chest. I'm done talking about paradoxical respiration. Let's proceed to the second type, and this is your penetrating chest trauma. So in your penetrating, sabi ko nga, there's a risk of air, okay, air that will accumulate in the pleural area. Okay? So remember, if this, drawing muna natin. Okay? So this is the right lung, this is the left lung. Okay? So the intrathoracic cavity is a negative pressured cavity, and the lungs is actually covered by another membrane, another sheet. Please bear with my drawing. Okay? And your heart is actually over here. It's on the left side. Sabi nga nila, di ba, ang heart nasa left side. Correct. That is why if you're in love, don't follow your heart. Bakit, sir? Because your heart is not always right. It's on the left. Sabi. Ganun ba yon? Yes. Okay, the intrathoracic cavity is a negative pressured cavity and atmospheric is positive. So can you imagine this? If accidentally sinaksak ka, you sustain a stab wound, okay, or binaril ka. So there's a break in the chest wall. So there's penetrating injury. So as a result, kung may penetration yan, there is what we call a break in the area, allowing air to get inside. So when air gets inside, they will accumulate in the pleural space. And air accumulation in the pleural space is what they call pneumothorax. Pneumo is air. Okay, so because of penetration, there's also a risk of bleeding. So when bleeding happens, blood again accumulates in the pleural space. We call that condition is your hemothorax. Okay, or combination, kinuha mo na lahat, blood and air, we call that your hemopneumothorax. Now, what I want to emphasize here for your examination is when air accumulates in the pleural cavity, in the pleural space, most often, okay, usually they will accumulate in the upper lobe, upper part. Remember, air goes in a high altitude area. So that is why if you will be asked, where do you think is the site of chest tube insertion if the purpose is to aspirate or remove air? Most likely, yung site ng chest tube insertion is in the upper lobe. Okay, upper lobe. Because again, air goes in a high altitude area. But again, this must be supported by an x-ray. Kaya nga, prerequisite po before chest tube insertion is your chest x-ray. Your chest x-ray is very important because that will give the doctor, okay, an idea where is the site of injury and where is the best placement of the chest tube. Not only chest tube, for thoracentesis as well. Okay, that's your upper lobe. But for hemothorax, because it's blood, okay, blood goes in the lower part because of gravitational pull. Most likely the site of chest tube insertion, if the purpose is to aspirate or remove fluid, it's in the lower lobe. Okay, lower lobe. Sometimes pag sabi mong upper lobe, usually it's on the second or third intercostal spaces. That's for upper lobe, for pneumothorax. Samantalang for lower lobe, for your hemothorax, usually it's in the third or fourth intercostal spaces. But again, kay chest x-ray is essential. But what about for hemopneumothorax? Dalawa yun, sir. Dalawang tubo rin bang ilalagay sa isang lung? No, usually isa lang, no? Nilalagay natin siya sa lower lobe kasi pag na-drain na natin yung fluid, yung blood, okay, ilalabas na rin kasama yung air. Okay? Now, what I want to emphasize here is your pneumothorax. Okay? Your pneumothorax comes in 3 types. May tatlong klase yung pneumothorax meron po. So, I'm going to clear this in my whiteboard. So, when I say pneumothorax, there are 3 common types of your pneumothorax. Now, what are the 3 types of your pneumothorax? May tinatawag tayong closed pneumothorax. May tinatawag tayong open pneumothorax. And tension pneumothorax. Okay, and by the way, just a heads up, other book, may ibang name yung open pneumothorax. They also call pneumothorax na open pneumothorax as spontaneous pneumothorax. You also call this as your spontaneous. Okay, so anong pinagkaiba nila? A closed pneumothorax is a type of pneumothorax na usually wala siyang penetration pero nagka-pneumothorax ka. Usually this is related to what? A ruptured air sac. Okay, usually related to a ruptured air sac, or shall I say a large bleb. A large bleb, especially to patient with emphysema or trauma. Okay, for example, may narinig ka na siguro, no, minsan naglalaro ng basketball. Alam mo naman yung mga Minsan may mga players na very rough when they play, and then naglaro ka ng basketball and accidentally, okay, nasiko yung chest mo na masyadong malakas or dinibdibang ka. So because of the impact, the ear sac ruptures inside pero walang penetration. Okay, so the ear sac ruptures. So when that bleb ruptures, so air accumulates in the pleural space. It's closed. There's no penetration, but there is pneumothorax. Okay, it happens. Okay, it happens. You call that your closed pneumothorax related to a ruptured bleb or a ruptured air sac. Okay? Now, when I say open pneumothorax, it's your spontaneous. Ito yung sinasabi natin na sinaksak ka, air gets inside. So it's called your open pneumothorax. Now, isa sa mga common na lumalabas examination is your tension pneumothorax. And this is the thing that I need to emphasize. Okay? Your tension. Why do we call it tension pneumothorax? And why do we call it tension pneumothorax? Inulit ko lang, ano? So the explanation is this. Okay. Grabe, tare, ang laki ng trachea. Anyway, so this is the right lung, okay, and this is the left lung. Okay, negative pressured cavity, I said that atmospheric is positive. And again, I said that the heart is more situated on the left side. A big part of the heart is on the left side, and there's still a little portion of your heart situated on the right side, but the big part, okay, it's on the left side of the heart, left side of the heart, left side of the chest. Ayan. Nilinis talaga yung drawing. Op. Okay. So let me explain tension pneumothorax. Now remember, this is your trachea. This is your trachea. Liitan nga natin. Hey. Okay. So your trachea is, don't forget the trachea is on the center, it's on the midline. Okay? So let's say sinaksak ka sa right side. Nung sinaksak ka sa right side, it creates an opening. So there is penetration. So it creates an opening. It creates an opening. O, di ba? May dalawang layer talaga, no? The parietal and the visceral layer. Okay, and so sinaksak ka. So what happens here is because of what we call penetration, air gets inside. Okay, air gets inside. So sabi natin, when air accumulates in the pleural space, we call that pneumothorax. So it's justifiable. So alam natin tinawag na pneumo because of air. The question here is, why do we call it tension? Because when you inhale, air gets inside. And guess what? Okay, itong butas na to creates like a flap, like a valve. It creates like a flap or a valve that it closes when you exhale. Okay, so when you inhale, it opens, it allows the air to get inside. But when you exhale, this flap, the penetrated area, the flap, it closes. So what happened here is that it traps the air inside the pleural area. So the cycle repeats. When you inhale, air gets inside. When you exhale, it closes. When you inhale, air gets inside. When you exhale, it closes. When you inhale, air gets inside. When you exhale, it closes. So the cycle repeats until such time that the right side here, that the right lung is filled with air, because again, it cannot get out when you exhale. So it turns the right lung now to become a positive pressured lung because of air accumulation. Naiipit niya. Okay, because of air accumulation, naiipit niya. And guess what? As air accumulates, okay, it turns now your right lung to become a positive pressured lung. The implication here is that as air accumulates, tension rises. And because tension is rising, okay, pressure increases. This right lung now will press the other side, will displace the other side. Bakit niya iipitin ang kabilang lung? Iipitin niya ang kabilang lung in order to accommodate the increasing pressure because of air build-up. Okay, so ulitin ko ha. As air accumulates, pressure increases, tension rises. As a result, this affected lung will press and displace the other side just to accommodate increasing pressure. So what will happen now is maiipit ang kabilang lung. Yes, maiipit yung heart. Yes, maiipit yung trachea. Yes. So as a result, Pag naipit sila, na-displace sila, ang tawag natin dyan ay mediastinal shift or mediastinal shift. Is it good? No, it's an emergency condition. Why? Because of mediastinal shift, the other lung can no longer inflate. Okay, because of mediastinal shift, the lungs are compressed. Okay, the other lung is compressed. The heart is also compressed, affecting its contractility, affecting its cardiac output. Isa sa mga indikasyon ng mediastinal shift ay isa sa placement ng ating trachea. I said the trachea is on the midline or center. Because of mediastinal shift, it can cause tracheal deviation. Madideviate siya. At isa ito sa mga favorite questions sa NCLEX. Saan daw madidisplace, madideviate ang trachea? Will it go towards affected side or unaffected side? The correct answer here is towards unaffected side. So maiipit siya, i-display siya, pupunta yung madideviate yung trachea towards unaffected side. So don't forget that in your examination. Now, balikan natin. Because of mediastinal shift or mediastinal shift, okay, the other lung is what we call compressed. Hindi siya ma-restrict yung affected lung. That's the most appropriate term. Ma-restrict yung unaffected lung. And of course, the heart is also what? Affected. So as a result, hindi makapag-pump ng maayos yung heart, and inability of the heart to pump adequately will decrease the cardiac output. And a decrease in the cardiac output, okay, a decrease in the cardiac output will result to shock. Am I right? Because a decrease in the cardiac output can cause altered perfusion. An altered state of perfusion is what we call shock. And what type of shock is that? Maraming klaseng shock, di ba? May hypovolemic shock, may septic shock, anaphylactic shock, okay? May cardiogenic shock. So what type of shock is due to decreased cardiac output? We call that type of shock as your cardiogenic. Cardiogenic shock. So don't forget this. Cardiogenic shock is the most common cause of death to patient with tension pneumothorax secondary to mediastinal shift. Ano daw? Ulitin ko. Cardiogenic shock is the most common cause of death among patients with tension pneumothorax secondary to mediastinal shift. Okay? So dito papasok yung mga chest tube natin. Okay, why? To release the pressure, to release to release the fluid, to release the air. So importante yung chest tube. Okay? So I'm going to discuss the chest tube now. So I'm going to clear the screen. By the way, let me check if you have any questions. Walang tanong. Okay, very good. Hold on, let me check my other account. Cancel. What do we have here? Anyway, thanks for watching, Gel Razon. Hi there. Hello to G. Canonero. Thanks for watching. And hello to Sibel Baltazar, Rosemary Pineda, Jana Paraiso. Thanks for watching, guys. If you have any questions, please drop a question in the comment box and I'll try to answer that. Okay, let's go back. So we'll talk about chest tube. Oh, bakit? Red yan. Gusto ko black. Chest tube. Okay? We're talking about the water seal drainage. Okay. So what I'm going to do here, I will draw the drainage, the one-way bottle system, the two-way bottle system, and the three-way bottle system. Here, may comment. Sino to? Jana Paraisa, good evening from Jeddah, Kingdom of Saudi Arabia. Hi, Jana. Thanks for watching. Okay, so we have the one-way bottle system. Okay, so this is the bottle. Lakihan natin. Ayan. Actually, ang matagal dito yung pagdodrawing ko eh. Mas gusto ko kasi magsulat. Okay. Okay, so this part here, this serves as the vent, and this is connected to your patient. So this is your one-way bottle system. So ibig sabihin, the one-way bottle system serves as a water seal and a collecting bottle at the same time. So if you notice, sa isang bote na to, naka-connect yung patient sa isang tube at yung tube na yun naka-immerse sa tubig, water. Bakit siya naka-immerse sa water? So that the water acts as a seal. Okay? Para hindi makapasok yung air into the lungs of the patient. And this serves as the vent. So, ibig sabihin, yung tube naka-connect sa patient, yung tip ng tube na yon immersed or submerged sa tubig. Okay? So, the bottle here serves as a water seal. Okay? And at the same time, it acts as a collecting bottle or a collecting chamber. So, kailan siya naging water seal? Because the tip of the tube is submerged in water, preventing air to get inside. Tinatawag siya collecting bottle because whatever fluid is coming out from the patient, the bottle collects it and you have to mark ilang ml ang itinaas ng water level. So that will be the output, okay? Your output for your shift. So this is your one-way bottle system. Okay? Ano naman yung two-way bottle system? Two-way bottle system. Oh my God. Nakakaloka yung drawing ko. Please bear with my drawing, okay? So ito naman na part, ito again naka-connect to the patient, okay? And take note, this is a two-way bottle system, so there are two bottles involved. So this bottle here acts as a collecting bottle or the collecting chamber. And this serves as the water seal. So kung napansin niyo, anong pinakaiba niya sa one-way bottle system? Sa one-way bottle system, isang bote lang and that bottle serves water seal and collecting chamber at collecting bottle at the same time. Samantala, ang two-way bottle system, separate ang collecting bottle, separate din ang water seal. Look, yung tube nakakonect sa patient, yung dulo niya hindi po nakasubmerge sa tubig. Okay? But that is an empty bottle because that is a collecting chamber. Ibig sabihin, if there is drainage coming out from the patient, may lumalabas na dugo, so you have to measure kung ilang ml yung output ng patient because this bottle serves as a collecting chamber, a collecting bottle. The tube that connects the collecting chamber and the water seal, yung dulo ng tube na yun po ang nakasubmerge sa tubig. Okay, nakasubmerge siya. Again, bakit nakasubmerge? Because this is your water seal. Okay, kasi pag hindi yan nakasubmerge, air will get inside the tube and it will get inside the lungs of the patient. You don't want air to get inside the lungs. That is why the tip of this tube is submerged in water. Okay, kaya itong bote na to, ito yung water seal. It seals the tube with water. Okay, so water seal. And again, this serves as your vent. Okay, so you call this as your two-way bottle system. This is your one-way bottle system. Now, what I'm going to discuss now is the three-way bottle system. Now, don't forget this. The principle observed in your three-way bottle system is the same principle observed in your plurivac. Okay, plurivac. So pareho sa ng principle na ino-observe. Hindi na common dito ginagamit sa Amerika ang bottle system na may mga bote-bote kaming dinadala. Plurivac ang gamit namin. Okay, but the principle observed in your plurivac, in your three-way bottle system, the same po. So explain ko yung three-way bottle system at ipakita ko yung plurivac sa inyo. Okay? But anyway, here. Ano ba tayo dito? Plurivac. Plurivac. Chest tube. Oh, here. I hope you can see this, guys. So this is what we call the plurivac. I'm not sure if you can see this, but this is your plurivac. Nakikita nyo ba? Let me check. Yeah. So that's your plurivac. The principle observed in your plurivac is the same principle in your three-way bottle system. Okay, yan ang gamit namin dito. So let's proceed. Let's talk about the three-way bottle system. So ito yung mga dapat tandaan. Whiteboard. Okay, so this is your three-way bottle system. Three-way bottle system. Tara, nagsulat talaga, ano? Okay. So this is the first bottle. Actually, yung three-way bottle system, extension siya. May extension siya sa two-way bottle system. Liita natin kasi may isusulat ako sa baba. Ayan. Ayan. O, di ba? So this is your collecting bottle. Okay. This is the water seal. And this third bottle is the pressure regulator bottle. Okay? So if you check yung collecting bottle and water seal, kung wala yan siya, kung wala ito na area na to, this is your two-way bottle system. Am I right? Diba? Ito yung two-way bottle system natin. Okay? Ito to the patient. Okay? So this collecting chamber or collecting bottle will drain fluid from your patient. Kaya collecting bottle siya. Nakakonect siya sa a second bottle, and that second bottle, the tip of that tube there is submerged in water. Kaya ito yung bottle na water seal area. So the first bottle is your collecting bottle. The second bottle is the water seal bottle. And yung water seal bottle nakakonect sa third bottle, but the tip of that tube, hindi po siya nakasubmerge sa water. Okay? Yung nakasubmerge sa water is this tube. Okay? And this part here, you may connect this to suction. Okay? So, ibig sabihin, yung water seal bottle at saka pressure regulator bottle, may tubo sila na yung tip ng tube submerged sa water. Okay? Now, in your NCLEX examination, in your qualifying exam, be very mindful of the question. Kasi kung ang tinatanong ay collecting bottle, so dapat alam mo kung anong nangyayari sa collecting bottle. Pag ang tanong ay water seal, edi dapat alam mo rin kung anong nangyayari sa water seal. Dapat alam mo rin kung ano mga dapat tandaan sa pressure regulator bottle. So ito yung aking topic. Okay, so I will talk about things to remember about collecting bottle, things to remember about the water seal bottle, things to remember about pressure regulator bottle. Okay, hold on. Check natin kung may mga question. Okay, walang tanong. Okay, very good. What about other side? Ito yung problema pag ang daming mong monitor, ano? Let me check. Just to make it sure. Wala. Okay, good. Okay. Okay, now let's begin with the collecting bottle. Okay, let's begin with the collecting bottle. So technically, para sa ano yan? This is the bottle that collects drains from the patient. Okay? Collects drain. Okay? Okay, collects drains from the patient. Now, in your examination, you should know what is the expected and what is the accepted output. Okay, accepted output. Normal po, okay, normal po, expected po that the drain must be less than 100 ml per hour. Okay, so if in your examination it tells you that a patient with chest tube has an total output of 300 ml in the past 2 hours. So will that be a red flag? Yes, it is. Kasi yung expected mo is less than 100. So kung mag 200, mag 300 na siya ml in the span of 2 hours, mataas ang or mabilis or mataas ang kanyang output. So you have to tell the doctor about it. So tandaan lang, the accepted output per hour is equal or less than 100 ml. So ang tanong, normal ba na bright red yung output ng pasyente na makikita sa collecting bottle? Yes, normal po, okay? Normal po na kind of bright red. Pero pag profuse na siya na bright red, that could be an indication of an active bleeding. Okay? Next, ano pang dapat tandaan sa examination sa collecting bottle? Don't forget, you need to mark the bottle. Okay? Why is it important for you to mark the bottle? You mark the bottle when upon admission, okay, or every shift. Why? Because so that malalaman mo kung ilan po yung output natin per shift. Okay, output natin per shift. Next, another thing to remember about the collecting bottle, if in your examination they use these terminologies. If they use the term dislodge, ibig sabihin from the patient. So pag ang ginamit nila, accidentally, the chest tube got dislodged. So what is your best nursing action? What is your priority action? Pag sinabi natin dislodge, ibig sabihin from the patient, so your nursing action here is you need to use what? Occlusive dressing or vaselinized, okay? Vaselinized gauze or an occlusive dressing. Okay? Pero pag ang ginamit na term naman ay disconnected. Okay, disconnected. Usually, saan yan? Ang problem is from the bottle. So for example, if a patient has a chest tube and the line got disconnected, what is your action? Your action here is immersed. Okay? Immerse the tip of the tube, okay, in sterile water. Kung wala kang makitang immerse, your second action is to clamp the tube. But the first answer is immersed. Okay? I hope that's clear. So tandaan yun ha, that's in your collecting bottle. Pero pag ang tanong naman ay water seal, ibang usapan yun. So water seal, tinawag siyang water seal chamber because it acts as a water seal. How did it act as a water seal? Remember, the tip of the tube is immersed in water. Okay, so technically it acts as a water seal, preventing air to get inside the pleural space. It acts a water seal, preventing air to get inside the patient's lung. Okay, now anong dapat tandaan sa water seal? Normal po sa water seal na may bubbling. But be mindful kung ano yung term ng description ng bubbling. Sa water seal, normal po ang intermittent bubbling. Pag ang ginamit na term ay continuous vigorous bubbling, that's an abnormality. Kasi dapat pag ang ginamit ay ang tinatanong ay water seal, dapat intermittent bubbling lang. Okay? And take note, kung ang bubbling niya ay continuous, if it is continuous bubbling, you suspect leakage. Ayaw nating may leakage sa exam. O, di ba? Okay, clear? Now, you mentioned, Sir John, na yung tip ng tubo naka-immerse sa water. Correct. So, ilang centimeters dapat naka-immerse yung tip ng tubo sa tubig? Okay? Eh, di ba dalawang tubo, okay, may isa pang tubo dito naka-immerse din sa tubig? Yes. So, ilang centimeters din siya naka-immerse. Yung technique natin, ang technique na ginagamit ko, yung water, yung voltage ng electricity sa Pilipinas. Ano ba yung voltage electricity sa Pilipinas? Di ba 220 volts? Di ba dito sa Amerika 110 volts tayo. Sa Pilipinas 220, yun ang ginagamit ko. So, sa water seal, 2 centimeters, samantala sa pressure regulator bottle, 20 centimeters nakasubmerged. So, 220 volts. Tara, no? So, take note, the tip of the tube must be what? Submerged or immersed. Immersed. Okay, immerse the tip of the tube. Okay, at least 2 centimeters. Ito 20 centimeters. Okay? Next, take note. Sa water seal, normal po na may tidaling. Okay? Tidaling. Sir, ano ba yung tidaling? Some, they would say oscillation. Pareho lang yan. What is tidaling? Tidaling refers to the rise and fall of fluid. Okay? Rise and fall of fluid. So normal po na may rise and fall of fluid in the tube. Okay? Rise and fall of fluid in the tube or there in the bottle. Okay? So kailan yung fluid rises, kailan siya mag-fall? So tandaan natin yung inhalation and exhalation. Inhalation, it falls. Exhalation, it rises. So there's rise and fall. Rise and fall of fluid in the tube. No tidaling, so you have to consider kailan na-insert yung tube. Pag na-insert yung tube less than 24 hours, okay? Less than 24 hours na insert or more than 24 hours na na-insert yung tube. Okay? So, ibig sabihin, pag walang tidaling, less than 24 hours na insert yung tube, anong implication nun? Okay, no tidaling, there could be obstruction. Pero pag walang tidaling, after 24 hours na had passed, na insert yung tube, most probably okay na yung patient. So, it could be an indication that there is already lung, okay, re-expansion. So paano mo malaman na may obstruction? Paano mo malaman na the lung had re-expanded? We do X-ray. Okay? So take note, pag walang tidaling, you have to consider kailan na-insert yung tube. Kung na-insert yung tube less than 24 hours, okay, you'll suspect that there's no tidaling because most probably there is obstruction. Pero pag yung na-insert yung tube more than 24 hours na, wala lang tidaling, most probably because the lung had re-expanded. So how will you differentiate that? Doctors may order for series of chest X-ray. Okay? Now, what about for your pressure regulator bottle? Okay, of course, syempre, this is the chamber, this is the bottle that regulates the pressure. Now, what is the most important thing to remember here is this part. This is what we call the adjustable vent. Okay, this is your adjustable vent. Ano ba yan? This is what we call the adjustable vent. And guess what? The more you immerse the adjustable vent in water, the higher the pressure you get. Okay, so don't forget this. Okay? Huwag kalimutan that the pressure gets higher. Okay? as, okay, as the adjustable vent, okay, is deep down in my heart, deeply submerged in water, deeply submerged in water. At nabanggit natin, we have 20 centimeters. The more you submerge that, the higher the pressure you get. And take note, may bubbling ba dito sa pressure regulator bottle? Meron po. And take note, it must be continuous, gentle bubbling. Okay? Question, what if ang ginamit na term ay continuous, vigorous bubbling? That is an abnormality. It should be gentle, okay, continuous bubbling. That is why for your examination, be mindful. Ano yung tinatanong? Ang tinatanong ba pressure regulator bottle o ang tinatanong is the water seal bottle? Okay? And take note, sir, what if there's no bubbling? If there is no bubbling, okay, ano mga possible troubleshooting natin dito? If there's no bubbling, ano mga rason? Number one, machine is off. The suction machine is off. Or number two, the line is actually obstructed. There's obstruction. Or number three, there's malfunction of suction machine. Okay, so this is your three-way bottle system. So for your examination, be mindful kung anong bottle yung tinatanong. Okay, so water seal bottle ba, collecting bottle ba, or the pressure regulator bottle. I hope you learned something, guys. There. Like that idea, 220. Oo nga, di ba? 220 volts kaya yung Pilipinas. Di ba? So yun ang ginagamit ko na technique para hindi ako malito. So 220 volts. But anyway, I hope you learned something, guys. O JV, so ito yung requested mo na topic and I hope I was able to answer the question. Kung ano may mga question mo regarding this concept. And another question here, how will you position the patient with chest tube? So there are two possible answers. The first answer there is you need to position the patient upright. Why is it important for the patient to be positioned upright pag may chest tube? That is to promote lung expansion. Pag wala ka makitang position the patient upright, the next answer will be position the patient side lying where? Lying on the affected side to facilitate drainage. Okay, another possible question here, positioning during insertion. Okay, during insertion, the best position is sitting upright, leaning forward. That's your orthopnic position, and let the patient raise his or her arm. Why is it important for you to position the patient upright, leaning forward to promote lung expansion? Okay, raising the arm for insertion. Why? To widen the intercostal spaces for easy insertion. Okay, that's the first answer. Pag wala ka makitang sagot na yon, the second best position during insertion is side lying on the unaffected side. So ibig sabihin, kung ang affected side is the right lung, position the patient left side lying para yung lung on top is the bad lung. Yun yung matusok ng doktor. Okay, so that's the second answer. So ulitin ko, the best position during insertion, the first answer is leaning forward, okay, leaning forward, and then arms, okay, elevated. This is your orthopnic position. That's the first answer. Pag wala yan, second answer is side lying on the unaffected side. So that the lung on top is the bad lung or affected lung. Yun yung matusok. Okay? And what was your important instruction during insertion? The most important instruction during insertion is Valsalva maneuver. Hindi po enough ang hold your breath. Hold your breath is not Valsalva maneuver. Magkaiba po yun. Valsalva maneuver, may pressure. Yung hold your breath, wala. But holding your breath is part of Valsalva. Ano yung pinagkaiba? Look, this is hold your breath. So I will hold my breath. That's holding your breath. Samantala ang Valsalva, it's different. Valsalva means you hold your breath and you bear down or you exhale. That's Valsalva. So ang Valsalva may pressure, ang holding your breath, different. Okay, but holding your breath is part of Valsalva. So mas maganda ang hold your breath and you bear down or hold your breath then exhale or Valsalva better instruction during insertion. Why? So that when the pressure is higher, okay, than your atmospheric, it prevents air to get inside because doing Valsalva will increase your intrathoracic pressure. Okay? So again, don't forget that JV, okay, request granted. Thank you, Sir John, and mararating na sa neurons ko. Hopefully. So anyway, thank you so much, guys. If you reached this far, thank you so much. I hope my videos are helping you in kung anong mang purpose ang video na to. Okay, so good luck in your examination, JV. God bless, and balitaan mo kung ano nangyari. Okay, so thank you so much, everybody. God bless, keep safe, and happy Mother's Day.